When you see the triage nurse in the emergency department, the nurse will ask you for your full name, date of birth, and the first line of your address. They will then give you an identification wristband, which you should wear at all times while you are in the hospital to keep you safe. When a healthcare worker comes to take a blood test, they will also check your identification by asking you to tell them your name and date of birth, and by checking your hospital number on your wristband. If you are attending the hospital for an outpatient appointment, you might not have a wristband. Therefore, you will be asked your name, date of birth, and the first line of your address. To keep you safe, it is important that you always get the right medications. When medications are being given in hospital, you should always be asked to identify yourself and have your wristband checked. If a porter is coming to take you somewhere, such as for an X-ray, a scan, or procedure, they will also check your identity in order to keep you safe. When you get to the department for your scan or procedure, a healthcare worker will have to check your name, date of birth, and wristband again to make sure that you are the right person having the right test at the right time. If you get a phone call from the hospital, it is very important that we can identify you. The healthcare worker should introduce themselves, and you should expect to be asked to tell them your name, date of birth, and address to confirm who you are in order to keep you safe. If for any reason you can't answer to tell us who you are, your wristband is your identity. Make sure you wear your wristband at all times in the hospital. If it has become damaged or falls off, please let a member of staff know so that it can be replaced. These are just some examples of when you might be asked. You should expect to be checked so that we can make sure that the right person always gets the right treatment or right test every time. We know that this might seem repetitive, and you might wonder why a member of staff, like a nurse or doctor, who already knows you has to ask this, but this is really important to us in order to keep you safe.